off, I want to thank all of you for being here and listening in on this very, very important topic here. And what I'd like to share with you is my perspective as a physician and scientist, and really share with you what evidence is out there for this new treatment paradigm that has very, very rapidly evolved within a period of about a decade. But before I get into that, I think we do need to acknowledge that these children that have a gender identity that does not align with their sex are truly suffering. That is not at question. We know that there's a very high incidence of depression, substance abuse, anxiety, and many other difficulties that these children experience. The question is what we're offering to these children truly helpful to them? And I think it will come to us as a surprise to many of you to find out that despite the fact that there are well-established treatment guidelines, not standard of care, but guidelines that have been presented, and this has been rapidly and very vociferously presented by many medical organizations, to realize that the evidence behind this new treatment paradigm is slim to none. And let me walk you through very briefly exactly where this has gone in a very short period of time. Now, the treatment that is being proposed right now had its origins in a number of studies that were done in the Netherlands, where they began this process of affirming rather than looking at the psychological basis of what was underlying this discordance between gender identity and sex, and began affirming that and then engaging in interventions to align the body to what the mind believed. Now, this came to the United States about 10 years ago. And prior to that time, it was widely recognized that when there was this problem that existed, that there was something that had gone awry, and it was addressed as a psychological condition. And most of the therapy was directed toward trying to understand what was going on at the psychological level and being able to help that individual to be able to come to terms with their body and their gender identity. And almost overnight, the whole paradigm shifted. And because, as Dr. Cretella had mentioned, on an ideological basis alone, it was put forward that the mind was correct and the body was diseased, completely turning that on end. Now, if you're going to take a standard approach to a treatment condition of any sort, not just gender issues, and make that drastic of a change, one would expect that there was either a landmark study that was done, a randomized controlled trial, or a series of very important findings that consistently showed that this is a good idea. The reality is there is no science to back this drastic change. Now, it's not to say that there haven't been studies that have been done. There have been studies, but to make that drastic of a change, and many times looking at studies that in themselves were fundamentally flawed or had various weaknesses. And I'd like to go over some of those with you just so you understand what we're talking about. And what I am saying to you is widely acknowledged by the experts that are putting this forward. I was just at an international endocrine meeting just last month where the new Endocrine Society guidelines were being presented, and the question was asked, what evidence is there that long-term we are doing good for these individuals? And these are the people that put forward these treatment guidelines, and the answer was we have no evidence. Now, what they do have is a series of uncontrolled trials, many small trials, convenience samples, and much that they put forward as the state-of-the-art science. Now, to be fair, when we don't have the answers scientifically of what's going on, we do, in many circumstances, need to act, but we always go forward cautiously, and we continue to investigate. We continue to ask what we call hypotheses. You know, is what we're doing correct? Is there another treatment approach that can be offered to these patients here? And we try to do this with the utmost of care. As Dr. Cretella had mentioned, much of what's going on here rightfully can be considered experimental treatment. But that is not how the public is hearing about this, and this is not what the patients themselves and the families that are dealing with this issue are being presented with. The impression is that this is standard of care, it's well established, we know what we're doing, and this is going to help your child. And it goes even further than that to say, if you don't do this, you are harming your child. I will draw attention, if anyone would like to read, for example, my professional organization, the Endocrine Society, and look at the treatment guidelines. They acknowledge right there in the guidelines, they use a grading system to look at the quality of evidence. And nearly all of the recommendations or suggestions, and they do say suggest, are based on low to very low clinical evidence. The highest evidence actually is presented in terms of complications of therapy. Let me walk you through some of what those are and how this ideology is really infiltrating our medical profession, which is based upon standard principles, evidence-based medicine, which we hold our profession accountable in all other areas, and be able to look at the evidence that is going on and why this ideology is really making its infiltration into this particular domain. As Dr. Cretella had mentioned, one of the early interventions that is proposed for addressing this issue of gender dysphoria is to engage in what's called pubertal blockade. This is a chemical way of being able to shut down normal pubertal development. And repeatedly by the experts, it's presented that this is a safe and fully reversible form of intervention. Yet, there is no clear study that was done in this population. Even looking at other situations, other diseases, and we do use these treatments, these pubertal blockers in children that go through puberty at an abnormally early age and in adults for other malignancies and other indications. But it has not been studied in this particular population. It is an off-label use of the medication, and to make the claim that it's fully safe when you have no data is really an injustice for not only our medical profession, but for our entire society. And to be able to say that quite frankly and be able to share that with the family that we don't have any evidence. Now, we do have evidence by logic and also by the existing studies that there are some potential difficulties with that. For example, the claim that it's fully reversible is self-contradictory, because what you are doing when you give pubertal blockade is you're interrupting a normal developmental process. Even if 5 or 6 or 7 years later you stop that intervention, you cannot go back in time. You've already altered that development. It is incorrect and totally false to say that this is reversible. It's already discussed amongst the profession the importance of those pubertal hormones in normal skeletal development, and there's concern that they may be at risk of osteoporosis later in life. But probably the most serious concern is the effect that this has, and again, getting back to what really sex is, okay, male and female, the biological purpose of sex is related to reproduction. One of the known major effects of doing this form of intervention is that we prevent that from happening. We actually render these children infertile. And when you follow up pubertal blockade by cross-sex hormones, it's generally accepted that this is going to be irreversible. And again, we're talking about children. Children that have no understanding of what it means as far as their sexuality. They're in the process of exploring that and developing that, and they're being made infertile. And it's at a time where they are making these decisions at these ages. There are many other risks that we know in treating and giving cross-sex hormones for other indications where we know that there's certainly risks. Some of them are known, some of them are theoretical. It's very well known that the risk of cardiovascular disease when you give these hormone treatments is significantly increased. Same with the increased risk of stroke. There's a potential risk of cancer, not only from the fact that individuals that are presenting as the opposite sex aren't getting the normal screening tests that they would need for the particular organs that they have within their body, but the hormone treatments themselves may influence that as well. So I don't have time to go through all of the concerns, but I hope that at least that brief introduction gives you an understanding of what we're putting forward as established science as the only way to go is something that needs to be challenged, and it's certainly something that is a threat to our practice of medicine and to scientific integrity itself. For any investigator to put forward an alternative hypothesis to this current treatment paradigm is met with hostility. In science, we often will ask questions, we will test the evidence that's presented, present alternative views, and be able to try to search for better, more effective, and safer interventions. That discussion is not currently going on at the level that it needs to go on. And that's why I thank all of you for being here today to join in this conversation and to join all of us in raising awareness for what's going on within the medical profession and really making plans for the future to correct the errors that are going on at this point in time. Thank you very much.